Effective communication with patients and their families in the intensive care unit can be incredibly challenging. Despite improvements in family satisfaction with the management of the ICU patient, we do know that there is much room to improve with regards to communicating with families in this setting. This study is a 2-arm prospective randomised controlled trial. Participants were the family members of ICU patients from 3 ICUs in Perth, Western Australia. Data was collected over a 19-month period from 2019 to 2020. 62 families were allocated to either the intervention or control arm, and the intervention participants were given pre-reading to complete prior to a family meeting that they undertook with the ICU physician that day. On this slide, you can see how we adapted the Choosing Wisely 5 questions to be more relevant to the ICU context. This table in particular formed the bulk of the pre-reading given to the intervention participants. We were hoping to prompt families to consider their loved ones' values and wishes when they were deciding whether or not ongoing ICU care, invasive procedures, or prolonged ventilation were appropriate. In particular, we hoped that families might consider the long-term outlook of the ICU stay and the likelihood of a meaningful recovery. We measured outcomes via a survey that was distributed to the families, the ICU physician, and the nurses following the family meeting. The primary outcome for this study was perceived involvement in decision-making by surrogate decision-makers in the ICU. We measured this outcome via the question, did you feel included in the decision-making process? We adapted our survey questions from the family satisfaction in the ICU survey. We also asked the family how supported they felt, whether they felt they received an explanation that they understood, and whether they had adequate time during their family meeting. In order to determine whether we could implement these questions in our ICUs in the future, we questioned the ICU physicians and nurses about the uptake of and the usefulness of the questions and whether the questions slowed the meeting. Although our preliminary data analysis suggests there is no significant difference in the primary outcome between the 2 arms, family comments, as I've outlined here, were reassuring. We hope that this study furthers discussion on improving communication in the ICU and also allows other researchers to consider ways to implement the Choosing Wisely questions in their own clinical context.